Parents, let's talk about something that a lot of you have questions on, and honestly, something that really gets to me a lot, and that's ear infections. Ear infections are one of those challenges, one of those struggles that I really can't stand when kids are dealing with. And I don't know why that is. I don't know why this gets to me more than others. It might be if we harken back, 5-6 years to some of our first patients. We had a lot of ear infection struggles. Our very first kiddo that we just shared about last week was someone dealing with ear infections. And we've seen so many stories here at Thrive of kids dealing with round after round after round of antibiotic, maybe on the brink of tubes, maybe even having that surgery scheduled, and we start getting them adjusted and we see them heal and we see their body get back on track. So let's talk about why this is happening so much and what are some natural options. What can you do besides rely on antibiotics and surgery for that? Really the key to understand this is understanding why they're taking place. So let's think about this. I got a little diagram here, and you might not be able to see it super well, so I'll kind of explain. In kids, this eustachian tube, that drainage, it's way more horizontal than it is with adults. So if you're picturing me sideways here, that tube points more sideways instead of down. That is, if you're a parent who's had a kid dealing with this, the reason that's often given as to why kids have this struggle so much. Hey, it's just because their tubes are more tilted or more horizontal instead of tilted, so fluid can't drain as well and that just gets stuck and infected. And that is definitely true anatomically, but it's not really the reason why this is happening, because this isn't a hollow tube like a drain pipe that if you just tip it down, everything drains out and you're good to go. These tubes are more like a collapsed muscular tunnel. It's like a tube of toothpaste, right? You can dump it out and nothing's gonna happen. You have to squeeze and push the toothpaste out of the tube. Same thing with ear infections. You have to push that fluid through the tubes. It's a motion called peristalsis. It's the same thing that moves food through your GI system. So the reason our kids are dealing with the fluid that is stuck, that is breeding infection, isn't because they've got horizontal tubes. It's because something isn't draining. There's a plumbing issue, and that's how we want to think about this. ENT stuff is a plumbing issue. There's not enough motion. There's not enough movement up here. That, more often than not, is related to some early life challenges and stresses, maybe the birth process, maybe some bumps and bruises and falls and knocks of the head that they dealt with early on. But the birth is really the number one reason that we see that, is if we have some extra pulling or turning or twisting, or maybe just the way the kid was positioned in the womb, their head was a little bit torqued as they were getting compressed in through that birth canal, that will jam up some of this upper cervical spine, which jams up some of that drainage in the ENT system. So the adjustment gently restores that motion, gently improves all that healing adaptability, plus improves the immune system itself, and allows our body to kick it and to get things moving. So we need to think about this differently. We need to think about ear infections being caused by an actual plumbing drainage issue and not just, oh, we've got not enough antibiotics in our system and now we can pump us full of medications. Now, there are a few other additional remedies that are helpful that we can recommend and point people towards when they've had some plumbing and drainage issues that we're still trying to get some momentum on. Anything like garlic mullein oil is a really helpful one that helps give kids pain relief and helps them just take the edge off of that sensitivity, and helping encourage that movement through lymphatic massage, right? A gentle motion and massage pressure down here, especially when you combine it with some warm compress or some heat here, that can really get fluid draining down, especially if showing you this SCM muscle, that side of the neck. That is where we have a lot of our lymphatic system. There's a big lymph chain that comes through here. So stroking, massaging, moving that down is gonna help everything else move through. And because movement is so good, even just being active, right? As long as your kid's not completely out of their mind and they can't really be comfortable, they're really fussing and whining, we can be playing and moving still. It seems silly, but like bouncing, bounding on a trampoline, that actually gets stuff moving, gets motion going. So use those things, use some of the extra supports, maybe back off of dairy a little bit since that can increase mucus production and make it harder for stuff to get moving through here. And we're gonna have a much better time getting out of this. So support the immune system, get our vitamin D, get our vitamin C, get our elderberry, all those good things, but mainly let's get drainage moving. Let's get this upper stress cleared out so we can keep our kids from dealing with these chronic ear infections that lead into then even more struggles down the road because we're getting wrecked by antibiotics and so on and so on. Could talk so much more about this, but I just wanna give you that little tip and input on this struggle. If you have questions or more thoughts on it, definitely follow Thrive because we're sharing this sort of information all the time, and reach out to us with any questions. If you want to get your kid checked and scanned, if you just want to learn more, we are here to help. Talk to you soon.